Hey everybody, hope you're all doing extremely well. Today we're talking about therapeutic exercise and the career paths within that discipline in itself. So when you think of therapeutic exercise, I'm sure that you're, obviously popping in your mind is physical therapy. Yep, that would be my guess too. But really, this discipline is a bit diverse, and it encompasses things that and careers and professions that involve people getting involved with some sort of therapy and making somebody better, or healthcare professionals in general. So there's a couple different areas that we are going to be talking about, and there's crossover between, like we did with exercise physiology, talking about cardiac rehab. But today we're really going to be looking at physical therapy, occupational therapy, and athletic training. So all three of those fields, what they have in common is they're all certified health professionals. Physical therapy, obviously, as most of you know a heck of a lot about, is working in some sort of a clinical setting where you are rehabilitation specialists, that you are dealing with bones and muscles primarily to rehab individuals either post-op surgery, pre-op surgery, or from some sort of an ailment or injury. In the field of physical therapy, I'm going to tell you this right now, because of the large amount of our baby boomers population that's aging, you're going to be working in geriatrics. If you don't like geriatrics, I'm going to steer you away from physical therapy for a while. There's many different areas you can do physical therapy in. However, in geriatrics is where you're going to find your most viable population. I worked as a physical therapy aide for a while back in San Diego when I was doing my undergraduate degree, and I really did not enjoy the work I did, believe it or not. That's why I still applied to PT school, but it wasn't my top choice anymore after spending about 500 hours working in different clinical settings. Primarily reason, I spent a lot of time at an outpatient center, and it was one of the top performance, and it had sports performance. It had all these different areas. It was really cool, really interesting. I enjoyed it. Spent a lot of time with these clients. My biggest issue was that I saw the same thing over and over and over again. And I can tell you my general population was 40, 50-year-olds who had knee or ankle or hip issues or shoulder. I had one day where I was working there, and I literally saw from 6 a.m. until almost 6 o'clock at night, only ankle injuries. Now, that doesn't happen every single time, but I was like, oh, you gotta be kidding me. I'm doing the same exact thing. And they were almost all in the same point, and it was boring. But some of you might like that. That's totally up to you. I also worked in the pediatric areas, and that was very rewarding, but very taxing and emotionally taxing too as a physical therapist. You run into a lot of disabled children, children that have cancer, children that have these neurological impairments that really make it challenging for you to do certain things. So at the end of the day, you need to consider these areas and why you want to go into them. Occupational therapy is really all about taking people and getting them back to the activities of daily living. How can they go to the toilet? How can they do X, Y, and Z? Can they walk from point 1 to point 2? All those areas are incredibly important that we think about, that most people think and attribute to physical therapy, but that's really primarily taken care of by occupational therapists. They are kind of the lifeblood of how we accomplish our simple tasks. So if you think about it, what happens when you have a stroke? Okay, you have some sort of a brain hemorrhage. You have an area in the brain that's affected, whether it's the left side or the right side of your brain, just depends. And then it affects your motor system. So if you have a hemorrhage on this side, you're going to have this side of your body, it's going to have some problems. Well, what do you know? Can you brush your teeth? And if you can't, because you've lost the control of that function, you're going to have to switch to the other hand and become opposite-handed, which is really difficult, especially if you're in your 60s or 70s. That's not going to be very easy. Occupational therapists will reteach you how to brush your teeth. Simple life skills. However, it helps us to get back into society. One area in occupational therapy that I really do want to hone in on, that I think is really, really interesting to me, at least as a brain specialist, is the emotional and psychological field. That we're working with people that come back from combat arenas and areas that have traumatic stress disorders. workers that can't go out because they have anxiety, they have issues, they can't go to the grocery store like you and I can because they have these mental anxiety attacks or these different areas. Occupational therapists are actively trained in dealing with people like that. So it's an incredibly viable field. Kind of OT and PT, they make similar amounts of money. It just depends on the setting that you're in and where you're at. Obviously, in rural area like Southeast Georgia, you're not going to make as much money as you make in Atlanta, working for these bigger clinics, in-home versus outpatient, and these different areas. So they're slowly starting to climb their way back up, but occupational therapy usually only requires a master's degree, where a PT now usually requires a doctorate degree. So there's some leeway and flexibility. Acceptance rates are almost exactly the same. GPA requirements, all the things like that are very similar. So be very cautious about that. Don't say, well, if I don't get a PT school, I'm going to go OT school. Yeah, you don't get into PT school, I have a really hard chance you getting into OT school as well. All right, athletic training real quick. Athletic trainers are healthcare professionals. If you think about it, back to your sports, if you've been involved in sports, some of you may be athletes, some of you may not be athletes currently at the collegiate setting. An athletic trainer is somebody who is a certified health professional. Certified. That means they can bill insurance for the things that they do. And they're going to be able to work with you on a day-to-day basis. They don't just wrap ankles and tape you and give you ice and things like that. They take care of you on a day-to-day basis in terms of physical rehab and aspects like that. Now, they do work under the directions of a physician, so do like physical therapists, so do occupational therapists. So, and athletic training, though, you're going to work specifically with athletes, and that's a really awesome part of the career. Problem is, in athletics, you're going to work 1,000,000 hours, especially when your sport is in season. You ever think about all the football games you have to travel to at the collegiate level? If any of the football players are in this class from Georgia Southern, you understand practices every day, travel games, things like that. What about baseball that plays 1 billion games throughout the year? That's not a billion, but a heck of a lot of games. Athletic trainers have to be visible at every practice and game. That's the requirements. So if you're lifting, athletic trainer's there. You're running, athletic trainer's there. Then they have to do rehabs for you. You have a game, athletic trainer's there, so they can be the emergency responder in case something happens. Incredibly great deal of amount of hours that go into athletic training. However, it's incredibly rewarding, and you can make a huge difference in somebody's lives, and you're working directly with athletic training populations. So those are kind of the 3 things you're going to be exposed to in this section, and I would encourage you to keep an open mind as we go through this, that these are really viable fields and they can mean a whole lot. So anyways, enjoy. We're going to sign off for now. Enjoy the module.